It's really an honor for us to have Frank here. Just two bits of information. I think we at Oregon State are really lucky to have him here, because he is, out of all the places he could have gone, he chose to come to Oregon State to spend his Fulbright fellowship. And so we're really lucky to have him. And he's here for one more month, so take advantage of it. And the second thing is just reflecting on Frank's work and contribution. I would say that there are few people really in the world that have contributed so much to the science of understanding how economic inequality shapes adolescent health and well-being. And so I assume they're interested in that, and we'll hear more from Frank. So it's really our pleasure. Over to you, Frank.
Thank you, David. Thank you, everyone. Notice everyone's sitting away into the back of the room. It's really nice to be here. Thank you for organizing this and inviting me to talk. Thank you if you're tuning in on Zoom. Welcome. I was asked to give a kind of more of a general multidisciplinary type of talk about child poverty and inequality. And that's what I'm going to try to do. I'm going to do my best to not delve into a lot of data or anything really technical, but you will see some charts and things on the screen to give you something to look at. This is going to be a story about child and adolescent poverty and inequality. For many years, I've been interested in social patterns in health and well-being early in life and the implications that may have through the life course. I'm going to start, if I can, with a bit of an exercise. I want you to look at this image here of a ladder and ask you to think about your position, your social position here in your local community, here in this town of Corvallis. I want you to think of the people at the very top of this ladder having the most money, the best jobs, highest level of schooling, and the most respect. And the people at the bottom of this ladder are those who have the least money, the poorest prospects for the future, least education, and so on. And I want you to make a mental note, or you can scratch a little number if you want, to decide where on this ladder you think you rank. Okay? So remember that number for a minute. Now I want you to think about all of America. Think about the most privileged classes in America right now, the most money, highest education, the most high-profile, respectful jobs, and so on, and the people at the very bottom of that social ladder. And now decide what number you might choose on this ladder. This is a very subjective measure of social status, socioeconomic position. And if you want, we can even do it again globally. Think globally about where you are in the world. Think of the people who are most deprived, worst off at the very bottom of that ladder, and the most privileged classes at the very top. If you've seen this image before, does this look familiar to any of you? This is a very widely used measure of subjective social status. And it correlates very closely with health and well-being. And so many outcomes in nearly every age group and health outcome that's been measured so far. And this is going to be a story about relative poverty and inequality. What's remarkable about this graded social pattern in health across rungs the ladder, you get the sense that this is more than just how much money you have. This is about who you compare yourself to. This is a sort of measure that's very sensitive to the reference group where you feel you fit in. And as we went through that exercise, I suspect most of you found yourself creeping up the ladder as you thought more globally about who you compared yourself to. So that's going to be important. That's an important part of the story I'm going to try to weave together. I'm going to talk about the role of relative poverty and inequality in relation to adolescent health and well-being. And then I have some other material on food security that I want to share with you as well. So this is the general social pattern you can see here. I'm not going to delve into the details, but if you in epidemiology, one of the most popular studies, famous studies called the Whitehall cohort study in the UK, looked at differences in health and mortality across rungs of that social ladder, and found that the correlation was as tight, if not stronger, than other measures of social class, like income or education and so on. Which right away should tell you that this is a psychosocial phenomenon. We're not talking about material poverty or a scarcity of resources, like in the abject sense of the word poverty. And the other thing about this ladder is that there's about a 5 or 10 year gap in life expectancy between the top and bottom. And here in the US, as well as Canada, right, and huge differences in rates of various health outcomes. So it's interesting as a developmental psychologist to know when that pattern first emerges in the life course, right? And the implications that might have. If you were to, I think, ask anyone casually on the street about why it is that less fortunate, less privileged groups have poor health, what are some of the explanations that people might have for that? You might, I'm guessing, hear an answer about access to healthcare, because that's usually a focal point for policy discussion. Can't get to a doctor. Or you might hear that it's all down to health behaviors. The poor don't take good care of themselves. They don't eat well. It's too much substance use and so on. But what if I told you that this pattern holds up even after you've accounted for differences in health behavior and access to health care? What we're seeing here is really a proxy of stress, chronic activation of the stress response, allostatic load, and that wear and tear on the body through the life course. And it gets under the skin at a very early stage of the life course, early in childhood, and sticks there throughout life. In young people, I'm going to show some data on children and adolescents. And here's some examples of the same gradient and different indicators of child well-being. These are 11 to 15-year-olds in Canada. And more evidence that this is a psychosocial phenomenon is that the pattern holds even through the relatively comfortable middle and upper social class groups. That there's always a rung above that's better off that you compare yourself to. And like I said, nearly every aspect of mental and physical health, every culture, every age group that's been studied so far will show this pattern. And as you probably understand, the odds that any child is happy and healthy, doing well in school, getting on with their peers and teachers and so on, the odds of all of those outcomes improve incrementally as you go up the social ladder, all the way to the very top of the ladder. And it's been interesting for me as a student in psychology. I really did not pay much attention to SES was a control variable. I really didn't think I would spend a career trying to dig into the psychology of it, but there's a lot of psychology going on, which I find really quite interesting. And the other, another slide here. This is some American data. Here, social class is measured in terms of the percentage of the poverty level. And I'm showing this because a few years ago, there used to be a so-called equalization hypothesis about the social gradient in health. That is that these differences in health show up in childhood, then sort of disappear in the adolescent years, and then reemerge in adulthood. But I got to tell you, after studying this for a while, I've never seen evidence. That came from a handful of papers, I think in Scotland. It's the so-called equalization hypothesis. But it endures. In fact, it generally strengthens across age groups. And so it wasn't really until I was a postdoc fellow, someone handed me a paper on something called income inequality, which I had no background or really much understanding about. But it piqued my interest because the gist of the story, the article that was shown, was not just that health is related to income, but that because income differences are growing, and the implication for public health, for population health, is not just that there are wider divisions in health between the top and the bottom, is that health is worse overall for entire populations. And this is a pretty big idea for a health researcher. And I thought it's been interesting to try to dig into that. I'm showing you data here from the Gallup World Polls, and young people that are included in the Gallup World Poll ask questions about their mental health in the past day. And you can see here, I think, at least two things. There's a big gender difference. There's an increasing, been a steady increase in these mental health problems over time. And thirdly, notice how it's fanning out between income groups. And that fanning out has been really interesting to try to figure out. So health is can become more unequal, sometimes as a result of income inequality, shifting the load onto more deprived groups. And these are some other more recent data from a researcher, Twinge in California. Charts like this are getting a lot of attention these days, and they're showing a similar increase, the rise in mental health problems in young people. And there's been some academics that are really running with a pretty simple, but I think a powerful explanation of that. It's being tied to time spent online, social media use. And indeed, if you look at slides on the left, we're seeing sheriff students reporting higher levels of loneliness at school. That's international data from PISA. And on the right are some American data from CDC on poor mental health in US girls and young women. If you were to look for the elbow in the chart, and you'll find yourself around 2011, 2012, when most kids by that time were using smartphones and on these social media platforms. And right now, it's perhaps the most powerful explanation we have. And other things are going on as well. I'm just chatting with David about how parenting has become more risk averse and other cultural shifts as well. But there's something about social media use, and I'm going to come back to this because there is an intersection with class inequality that underlies the reactions, the effect it seems to have. So let's start here. This question, does income inequality matter? And how is it shaping patterns in health? And do these effects show up in younger age groups? It's a literature that usually describes life expectancy and mortality rates. But as a postdoc, I got interested in whether or not these patterns and international differences in health and well-being would correlate with income inequality. The gist of the story, the broad conclusion is that more equal societies that have narrower income differences between rich and poor generally have better health outcomes, higher well-being, fewer social problems, less violence and crime, and all the rest. And also more social resources, like indicators of social capital, social trust, and things tend to be better as well. And it also relates, there was some evidence a while ago that it might also relate to child and adolescent health. And so a lot of this work has been led by an epidemiologist in the UK, Richard Wilkinson, who's written some really interesting papers that generates a lot of discussion, heated exchanges in the BMJ, for example, and debate between epidemiologists about the quality of the data. But this is an example of Richard Wilkinson's scatterplot science. Here on the left, you can see in a handful of rich countries, the UNICEF index of child well-being correlated with income inequality. With the conclusion here is that it's the distribution of wealth that matters most to that outcome, not the amount of wealth maybe should those countries have. Pretty powerful. You can already kind of sense the political discussion around that way of thinking. Okay, bringing it back to adolescence now. When I first got into a study as early in my career, the WHO Health Behavior in School-Aged Children Survey, which I've been privileged to be a part of now for almost 20 years, I thought it'd be interesting to go through some of these health outcomes and see how much I could replicate in young people. The HBSC survey used to include the United States until about 10 years ago, unfortunately. Right now, it's Canada and pretty much all of Europe covered. This is a school survey that's rolled out every 4 years, and it taps into all sorts of health and well-being indicators, including school violence and injuries. It's rich in social contextual measures as well. And it's been a really nice resource. Now, it's been going on since the 80s, so it's also become a useful resource for looking at trends in health. My first look at HBSC data with a view to income inequality started on school bullying. One of the closest correlates, strongest correlates of income inequality is homicide rates when you look internationally. Most indicators of violence, social mayhem of some kind, is pretty tightly correlated with economic inequality. And of all the things we've measured in HBSC over the years, school bullying, the percentage of kids that say they were bullied at school, pretty tightly correlated with income inequality. In fact, you could replace those dots in the countries with, say, rates of homicide. And the countries line up in about the same place. And this is the first stab at it, and later a replication study on school bullying. And of course, it doesn't stop there. We've replicated that on different outcomes, each time controlling for wealth at the individual level and how rich the country is. And almost every time, it's income inequality. The gap of incomes in countries related to more bullying, whether it's victimization or perpetration, less physical activity, higher body mass indices, more symptoms of ill health, lower life satisfaction, more problematic use of social media. I'm going to come back to that study in a moment, and also larger differences in health. So what would be driving that? How much, is there any theory to explain what it is about income inequality that's affecting how young people get on with one another? This brings me to a very old theory called relative poverty, relative deprivation theory, which has been with our colleagues over in economics for decades. And because they do a lot of work on what it's like to have a high-paying boss, or what it like amongst employees, how much income differences matter. And generally, as you might imagine, when you perceive a larger shortfall in wealth or income between you and everyone above you, amongst your circle, that fills you with feelings of frustration and resentment. And this is really the theory behind these effects of income inequality. The shortfall in wealth and income or perceived status will start eliciting these feelings of frustration. So pair that with what kids are doing online and social media platforms, the sort of images that they see constantly about beautiful, successful people, right? That you can see how this may be driving that sort of interaction with social media. It's not a new theory at all. There are plenty of economics that will take credit for it, but if I can hit you with the Karl Marx quote. This is a liberal education institution. You can handle a Karl Marx quote. Who wrote many, many years ago that, and I'll paraphrase, that if your house has all the aspects of a normal house, it should satisfy your needs. But should someone build a castle next to your house, it suddenly becomes a hut. It becomes a reminder of your low social position and how insignificant. And if there's some measure that, wealth floats all boats, if the government were to step in and improve the state of your house and all the other houses on your street, it will not fix that problem. It's not a new idea, but turns out it's a very powerful explanation of what's going on. And we don't need very sophisticated measures. If we were to measure everyone's relative poverty or relative deprivation here in this room, how do we go about it? Well, we would rank order everyone based on their income. Already we're starting to feel uncomfortable. So just imagine we were to do that. So we have all the students on the low end, right? And the faculty members, we'll put David up at the very top. So David, we're all looking upwards. And this is how an economist would operationalize this construct. We would now calculate the difference between our salary and David's all the way down the ladder. And we sum up all of those differences. And now we have a measure, an aggregate of income inequality. But we can study this at the individual level, right? In HBSC, this is the tool we use. It's very basic. It's a measure of material assets based on some characteristics of your house, cars and bedrooms and number of bathrooms. You wouldn't think that this would like shape a pattern in adolescent well-being, but it really does. And when we do this, use this scale and measure this relative deprivation thing among young people within their schools, as they're comparing themselves to better off schoolmates, we find exactly the same outcomes. After controlling for how rich the school is, doesn't matter if it's a poor school or rich school, your relative position within that school, right, is related to bullying, more involvement in bullying, less physical activity, more alcohol use, poor health, life satisfaction. Again, more use of social media, more addictive uses of social media, I should say. It's more problematic, they call it problematic social media use, but we have screening tools in our HBSC questionnaire to pick up on more addictive uses, like compulsive uses of social media, also internet gaming and gambling. There was some work I've done with the group in Italy where it's a big problem on young people, gambling. All of that while controlling for inequality. So I hope by now I've convinced you that the story about poverty and adolescent health, it's more than just income. It's the social context that matters so much to shaping these outcomes. I'm going to transition now awkwardly to some work I've been doing on food insecurity. It's really just another window into poverty. And I've been interested in a while now on about the effects it has on emotional, mental health, right? And you probably know well the effects it has on physical health. But there's some strong effects on mental health and emotional health among young people that I think are worth a close look, because the effects are not fully explained by SES. They're not fully explained by income. Going back to Gallup for a second, when I first took a stab at this, one of the questions I had about food insecurity, which is a measure of not just food shortages in the house, but being worried about food shortages, worrying about having to cut meals or skip meals, and so on. Food insecurity is a larger psychosocial construct. It's more than just or going hungry. The Gallup World Poll has been collecting these sorts of data in 160 plus countries for years. And one of the questions I had going in was whether or not being food insecure is somehow more painful in a country like this. In the land of plenty, does food insecurity hurt more than, say, in a context where everyone's sort of sharing this experiences of scarcity? And it does. And this is the very simple theory of relative deprivation explains why it is that here in the US, in Canada, and the UK, household food security is a sledgehammer of a social determinant of mental health. And it still has an effect on mental health throughout the global south and in poor countries as well. But it's especially tough here because it's a continual visceral reminder of low social position. And I found that I've been finding these effects of food insecurity on adolescent mental health in many ways more robust than anything I could find with my HBSC family affluence scale. Controlling for household income, sometimes controlling for tax-linked household income as best you can. The experience of food insecurity is related to, like there's a gradient here as well in most indicators of mental health. And here's some Canadian data: mood disorder, anxiety disorder, major depression, suicide ideation. All of these are going up with experience of food security. Another Canadian study, students and I have been looking at this shielding, parents who naturally want to shield their children from the experience of food insecurity. So they're the first ones to skip a meal or cut meals so the kids don't go out. And the question here was, does that help protect kids from this mental health impact? Does sort of, I mean, I'm summarizing a lot of results here. It does a little bit, but it doesn't spare them completely. And more recently, we've done some work on suicide ideation. I know this is pretty dark research, but I feel it's very important. And in Canada, at least, it's very rare to have good data on suicide ideation. And it's one of those topics that researchers and ethics boards are always squeamish about getting into a survey. We worry about, managing risk and so on. But it's important to have this data. These data stand out because it's parent-rated food insecurity, youth self-reported suicide ideation, suicide attempts in the past year, feelings of sadness and hopelessness, and having been diagnosed with a mood disorder. And you can see that there's a graded effect here as well, a doubling, tripling in some of these outcomes. Again, control for household income. The effect is still there. So poverty and food security do not line up perfectly. There are groups off the diagonal you have to identify. We haven't had data overload. I'm really trying not to look at graphs and just talk about it, but it's I find some of the visuals really compelling. As I mentioned earlier, when you start finding, when you realize that many of the health outcomes we're looking at in young people, and the more proximal risk factors for them, whether it's in family functioning or the quality of parenting or other risk exposures, neighborhood crime, and so on, all of these things share a similar social pattern. All of these things are related to wealth and affluence, right? Which actually draws your attention sort of upstream. I'm borrowing from a metaphor that's often used, at least in Canada, among policy experts. They look upstream towards the broader social and structural determinants of all of those things. And if you put income poverty and food security into a similar lens and consider upstream, internationally, of course, there are some countries that are better able, better equipped, better resourced to protect families and young people from that experience. This is a study looking at country differences and something called state fragility, which isn't my favorite term for it, but we're looking at basic functions of the state to serve the basic functions of government. And it brings in things like forced migration and conflict and war and a range of other things. It relates closely to country wealth. But I just want to draw your attention to the slide that really, the scatter plot that really matters to me is the one on the very left. You see the correlation here with food insecurity, measured with one of those food insecurity experiences scale. The dots in yellow or orange are African countries. Europe is in red. And it turned out to be a very powerful determinant here. Here's the scary part, though. This is what the data points looked like as I collapsed a bunch of survey cycles together, where they moved for over just a 6-year period from 2014 to 2019. There was a surge of food insecurity, particularly in the more conflict-ridden areas of Africa and Southeast Asia. That's really driving that association. So we're really this is really macro now, but we're getting a better sense, I think, of some of the structural issues behind food security. A lot of these are economic, but it's not, it's a bigger, more complex story than just economics. The trends here, I know here in the United States, at least in some states, like in Canada, have been showing like the poverty levels are pretty flat, but food security just going off the scale. And it's hard to understand why it is. It's become a topic now in Canada. We have an election coming up. Justin Trudeau, bless him, I don't know why it took him 9 years to get interested in a national school food program, but he is. He's not doing well in the polls. So I don't know if this will come to fruition or not, but we're finally talking about a national school food program for provinces that haven't gotten it together. It becomes a squabble about jurisdictions. And I know here there's some states as well trying to find ways of improving this on this problem. Pretty contentious, I'm finding, but I don't know what the solution is. Happy to have a discussion about this as well. I'm looking at this time. I want to spare plenty of it for a discussion. I have. I'm sorry if I ran through this too quickly. I have one more slide. I just want to share this one big idea with you. And I hope when you consider all the social and structural determinants of population health, I hope I've convinced you by now that socioeconomic conditions matter a lot. Young people are not protected from it at all. It doesn't disappear in adolescence. It sticks, it gets under the skin early in childhood and stays with you. And it's not just about wealth, how now evenly it's shared, but how effective our policies are going to be in reaching groups, equity deserving groups from those sorts of outcomes. I think it's useful this is a useful chart to appreciate how powerful the social and economic piece is to overall health. And contrast that with the amount of attention and resources that other areas, branches of science get, particularly with clinical care and medical interventions. Overall, health behaviors and social and environmental pieces of that puzzle is the lion's share to explain how it is we have the health and health outcomes that we do. I think this is useful because it's very unlike the way we distribute resources for research and education. Before I forget, this is a slide full of logos, but I want to just acknowledge the funders behind all the research that we've just seen, including Fulbright Canada, and thank Megan and David and everyone here again for hosting me here in Corvallis. It's been a lovely time. It's been such a nice break, not just from winters in Quebec, but it's been, I just appreciated the people here as much. It's a beautiful, beautiful surroundings. So thank you for your time. We have lots of time for questions and discussion. I'm going to pause it there and stop talking. Thank you. It is. We've improved public access to the data set. So every time there's a survey, there's a network of a few hundred investigators that have first dibs on the news data for like a 3-year window. Like you can go to the website and pull data from previous cycle double, I think 51 countries, like 250,000 cases. That's right. It's repeated cross-sectional survey. Yes.
I mean, I know the US dropped out of HBSC because they insist on putting a U in the name.
That's right.
Family affluent scale. How often does that get updated and revalidated? I mean, things change so fast, and they used to ask like how many rooms you have, in the house, and then something to be updated, like maybe whether you have an electric car, one on the TV. So it seems like that needs to change very fast. And I'm just wondering.
Yeah, it has its roots in the old Scottish deprivation index, the early 80s. That's where it started. Like you'd have a telephone, it's a TV, black or white or color. Like, we're currently undergoing another exercise to expand the scale, to add some items. I've been arguing for a more tailored approach. I don't know why all countries have to use the same indicators if we're interested in relative poverty, not absolute, right? Because why measure cars in Greenland or snow machines? And we're like, you're right. I don't think it's tapping into everything you can. But when you consider all the cultural and economic contexts that are represented, it turned out these 6 items fit even the dishwasher. You'd be surprised. But we could certainly add more. Things like smartphones, I think, will become quickly dated as the problem. I'm not sure. But if you have suggestions for what could be added.
No, also just things like bathrooms. How many bathrooms is highly correlated with family size, so that's not really out.
Yeah. There's a lot in many countries, US and Canada now. They had a problem tapping out. This was a measure that was sort of capturing the lower end, but wasn't differentiating very well in the top at the top. So we've been thinking about more luxury items. If you have a second home, you have a cabin your family uses in the summer. Vacations out of the country. But it's a running target. Like as soon as you've caught up, sort of like things change again. A big question.
Well, I was just going to add that I think what you said was really right about how it's really relative versus absolute. I mean, when you just talked about the cabin, I thought of when we lived in Norway. It's like, well, everybody has a cabin at Hutta, and they don't have like their bathrooms are inside the house. I mean, they're extremely like primitive, and so most probably Norwegians might respond that they have a second home cabin, but it's not like right. It's not necessarily a something that indicates well.
That's right.
So I'm curious. Yeah, I wonder how much traction your suggestion is getting.
I hope it's some, at least in like weighting the importance of things could be.
Probably.
Vacationing out of the country would depend on whether you live in Switzerland or in Nebraska, right?
That's right. That's right. If you live in Luxembourg, I mean, where are you gonna go? And how many cars? Like, there's another like big rural urban split in number of cars you have. Right? I don't know. I live downtown Montreal. I don't have a car. Why would I need a car?
Clearly, you're not doing very well.
But clearly, I would be.
Come on.
No vacation. No cars. Yeah. But it is remarkable in some ways that such a rudimentary tool could separate the absolute and relative.
It seems like a screener more than anything, like as you say, differentiating, not so much it's just like the top high versus low versus the maybe.
Yeah, it'd be nice to have more luxury items there. How many pairs of shoes?
I had one thought on the fluence scale would be something like, can you participate in sports? Because like usually sports are like these extracurricular. If you don't have money, you don't. Or that's one of those things kids are watching too.
Yeah.
So just this thought on that. And then my question was, I was wondering, like in Canada, like here it's pretty nice. Like if you get behind on your school bill or nutrition, they'll still feed your kid. But like, how does it work in Canada? It kind of the national income scheme. So with the national program, if they were to pass it, they kind of give a little bit. Like during the COVID epidemic, every kid could eat, but I don't.
Yeah. Well, Canada, when we have 13 different jurisdictions, so this is the squabble politically. It's which level of government is responsible for this. Justin's idea is to support programs that exist and start programs where there's nothing. But it's not strange that it's just not really on fire as an idea. Better to just shove the money out to the provinces and let them sort of But we had big differences. The big problem is in the north, where we have more than half of the population food insecure constantly, and that's down to geography. Food prices in Nunavut and Northwest Territories. It's just imagine Iceland, but more. Like it's just really extreme.
That was going to be part of my question is, so there's not so much that there isn't a sentiment that shouldn't be providing food. It's more
Who's responsible for it? Should it be big government or not? Yeah. Yeah. I heard on the radio just this morning, I was telling David that there was your federal government was proposing to supplement free or reduced cost school lunches for kids that rely on this through the school year to have something for them through the summer months. But there's some resistance from some Republican-led states against that. Even though they'd be responsible for just part of the administration cost of it.
I think it goes down to like who's responsible, right? As you say, like, I think, is that a similar debate in Canada? Here, it's like, are you personally responsible or should the government be responsible? I mean,
Yeah.
I'm not agreeing. I'm just naming that debate. We somehow couch it, even though it's crazy in my opinion to couch it that way, but I feel like that's how it lands sometimes.
Yeah, there's been discussion about, I guess, a food stamps equivalent sort of program in Canada, but the thinking always is, well, we need to leave it for families to decide where to put the resources. We'll just do the cash transfer instead. So that's where the emphasis has been. But with energy costs and rising mortgage rates and everything else, food seems to be the area that gets cut first. Unfortunately, it just seems like I know that programs like that have a sort of paternalistic overtone to them. Like, should this be what the government ought to be doing? But isn't it better and more efficient to just flow their money? But if it's like relieving one source of stress for the family, it just seems like, I don't know, a no-brainer to me. But I don't fully understand the politics behind it. Like, to me, am I wrong? But this is like a popular policy here. Yeah.
You mean what? The food insecurity?
SNAP.
SNAP.
Yeah.
Food that.
People hate SNAP. Like, what's going on? I thought it was pretty popular. But
Popular, but it's not enough.
yeah,
I think
yeah.
that's true.
There's an income bracket.
And you don't, or they're the working poor and they're just below. It's.
Yeah. Okay.
I mean, you have more of a safety net, I would think. I don't know if that's correct, actually. That's a question. It seems like Canada has national health care. Like, you guys are looking great comparatively. But, it seems like you still have the same issues, but maybe not as extreme. I don't know.
I don't know if our outcomes are much better. And it's like a different patchwork of programs and subsidies. Yeah, I think we do cash transfers well. If it was not for some redistribution, our income inequality would be as high as it is here. So we move money around. I don't know. Taxes are generally a little higher. But we don't it's rare to see the arm of government on such a specific thing like SNAP is here.
I think with SNAP, at least, all parts of the political spectrum at least accept it to a degree.
Mm-hmm.
I mean, some really embrace it, but others, I think, at least accept that as there is needed. I don't think the existence of SNAP generates that much debate. I mean, David's closer to me, a little people closer to me. But one thing that does happen is that there have been debates. I know this happens to come up in SNAP Ed, about what restrictions should be placed on eligibility to buy this food or that food. Maybe should people not be allowed to buy expensive foods or foods that are bad for them or soda? And then it gets to be a real debate sometimes. So the argument against that is that it disrespects families to say, oh, you can buy this, but you can't buy that. So that is something that pops up a lot. But the existence of SNAP, I believe, is big.
Yeah, absolutely. I mean, in discussions I have, if we want to contrast cash assistance and of welfare, that's very few people. It's very meager. Whereas SNAP, you know, you can only use that for certain foods, like Marcus talking about. And in Canada, they have kind of the opposite thing going on, where cash, there's a child and family allowance. Every family with a child gets $300 a month, regardless of income.
Yeah.
You know, just to put it, I mean, that, I don't know what the numbers are, but it's something like that. It's hundreds of dollars per month.
It's like, wow. I think we should move.
And you don't pay for health insurance. That's great.
So these, you know, it's very different philosophies about how to design the welfare system.
Yeah, and it's not easy to like port a program or policy like that from one country to the other. You know,
That's what I wondered with the other countries. Do most have things like SNAP or what Canada does? Did you do the European one?
most have something
Family
like
allowance,
this.
child, family.
Mhm.
I don't know if they have like SNAP debit card. Like
Or they're highly subsidized, like childcare. I only know because I lived in Norway for a while, but they're highly, so it's like a 40-hour a week, high quality, incredibly looks like this incredible place where you grow your food in the yard and everything's this wonderful, enriching childcare environment, preschool environment might cost a family $200 a month. Like so much cheaper, it's not even comparable. And because it's just so highly subsidized and regulated by the government. Now, there's only 5.5 million people in Norway, and they're the 7th richest country on the planet. A different situation, but it's an interesting contrast.
Yep.
We did think about moving there. It's a little dark in the winter though.
I was with that's okay. I was planning here. I wanted to reach out to them about social media.
Yeah, it's like well, I can tell you that the work that I've been doing mostly with the group in Italy was interested in this. We've been looking at patterns in social media use and at the extreme end of more compulsive, can't put it down type use. And again, as I showed you, it's more common among the poor kids within their school and also among kids in the high income inequality countries. So together it tells me that there's something about the status anxiety, the unease about social position, and that may be driving some of that. But it's almost a universal phenomenon now. You have this rise in mental health problems across Europe, every country in HBSC showing the same trend. And the concern is these kids are they've skipped a stage of social development that's now hitting them hard. I know if those of you who are lecturers here, you must notice this wave of fragility in our first year students, especially, and the need for extra supports and I was in a dining hall the other day, so whisper quiet, it used to be the rowdiest parts of campus. It's locked to their screen. So there must be some we've not yet felt the impact of that, and add COVID to it, where everything was motivating them to spend more time on it. Yeah, I think cause for concern about where we're going to end up in terms of mental health and suicide and all the rest. So I don't have a happy story about it. I think it's an important area of research. I think the platforms themselves shoulder some of the responsibility to help kids balance the time. And right now, there's no rules on it. There's no restriction on that. I think some states have now introduced age limits on opening an account on Instagram.
He's kidding. They just made up their own.
Make it up.
Okay.
They were doing that
Oh,
when
you
they were
picked
7.
What year were you born and you picked the year and that's the end of it?
Oh, yeah. That's their control. Yeah.
Having spent this time in the US, what's gonna change for you when you go back to McGill? You know, in terms of like your research, your questions, the understandings of your colleagues, I mean, has it expanded? What do you think about in terms of Canada?
That's a great question, and I have to do some reporting now to Fulbright Foundation on how much I've learned. The question, the discussion around food security and SNAP specifically, I appreciate much more now than I did before I left Canada. And because from time to time, our news coverage in Canada will talk about SNAP and SNAP Ed and alternatives for governments in Canada. We look at the program and then talk ourselves out of doing anything. I think it's worth another discussion. At least, like, what is the role of each level of government in tackling this problem? Right now, we're not. If anything, rising food insecurity is driving every other metric of inequality I can think of, because it compounds poverty in the truest sense. It's harder on lower incomes. It's really tough to ignore. And so it's just creating this divide. I think it's a problem that we need to sort out. So coming here is giving me another glimpse, another approach to tackle that. So I have to be more of a rebel when I go home and try to get that discussion. And well, thank you all. I think we're coming close to the end of our time slot. Was there anything online though? Okay. Thank you so much. It's Friday afternoon. You could have been anywhere. I'm glad you were here with us. Thank you for the discussion. I appreciate it. And I'll see you around the next month or so.